In today's video, we're going over a common soft tissue technique that we do in our office called scraping. Now, scraping, or what us nerds call instrument-assisted soft tissue mobilization, ever wonder why we just call it scraping? That's a crazy long name. Scraping involves taking a specialized tool and gliding it over the skin to help reduce tension and reduce pain. Whenever we do a soft tissue technique, regardless of the technique, we are trying to improve the brain's awareness of the area. This gives us better control of the area, allows it to move better and feel better. We also get better recovery times and better healing times, and that's what you want, right? If you have an injury, you want to heal quicker, you want reduced tension, and that's what we're trying to do with scraping. So let's talk about how we apply this technique. So when we're going through a scraping session, we go through three main steps. The first one is we are simply combing through the area to try to figure out where we feel excessive tension, excessive stickiness, so we know where to focus our treatment. Number two, we're going to passively move the area that we're working on. We're going to move that muscle or joint for you so we can get the full extent of the muscle. And number three, we're going to ask you to actively move the muscle as well. This allows us to get that brain input into the area and get the full extent of the treatment. Now, should you be doing this at home on yourself? We often get asked that question a lot. Can I just do this at home on my own? I've seen these advertised online. I can get one and I can just do it myself. And that's true, you can, but we need to ask ourselves three questions. We need to ask ourselves the what, the why, and the how. Okay, do you know what you are scraping? Do you know what the anatomic structures are that we are working on? That's important to know. You don't want to just go working willy-nilly and hoping to see a result. You need to know what you're working on. Number two, we need to know the why. Why are we working on a particular area? Oftentimes we don't always work on the area that feels the tightest. We may work somewhere else because it's impacting an area, making it feel tight. For instance, if we feel tension or pain in our knee, it might not be a knee problem, it might be an ankle problem, it might be a hip problem. So we may work primarily on the ankle or hip. So that is going to be the why. Do you know why you're working on an area, why the biomechanics are the way that they are? And then finally, the how. We don't just mindlessly scrape through muscles. We have different techniques depending on the body part that we're going to use to get the best results for you. So do you know how to work on a particular area? Now that comes with training. So it's really important that we see a trained professional for this. But if you do this at home on your own, are you going to hurt yourself? Probably not, right? It's pretty safe. You're working on the surface of the skin. As long as you're not getting too aggressive, you'll probably be fine. But are you getting the most out of the treatment? Are you getting the best results? Also, probably not. We go through a lot of training to know the what, the why, and the how. So if you want the best, the quickest results, it's important to see someone who is trained in the technique. So if you are experiencing pain, injury, or tension, scraping might be a good option for you, and we'd be happy to talk you through that process. So visit us online at TruMotionTherapy.com to learn more or book an appointment.